Good morning, and thank you very much for joining us. I am Iyori Folari. Our president is in the U.S. as we speak. Not that he really wanted to be in the U.S. He wanted to be at the United Nations General Assembly. If you want that, you're going to have to be in the U.S. I mean, it could have been anywhere, but it's in the U.S. My guest this morning is Dr. Tuyi Mebawoudu, our public health expert. And Dr. Mebawoudu is with us, among other doctors. We'll be speaking also with I believe Dr. Thomas Wilson Ikubese. Why you're here is that one of the things we understand the president will be not just interested in, he'll also be addressing the General Assembly and consequently the world on the whole question of vaccine equity. So that's what we should talk about. There are quite a number of other things I'm sure that maybe the president might want to touch on, maybe security records on security. But first things first, health. Health is wealth. And the whole concept of vaccine equity, on a simplistic level, I imagine it just means that, look, you can afford. We can't afford. Are you going to watch us getting sick and die? Aren't you a Christian, Muslim, Sikh, whatever?
Or believer.
A believer of some sort?
Or believer.
Is this good? Some of you have even bought more than you need, and we can't buy what we need. Just refresh us, please, just slightly before we go into the topic. In terms of coverage, what's your idea of the coverage we have for vaccines as of today in Nigeria?
Thank you, Yori, and thanks for having me. Let me lay basically the background for the discussion. United Nations is getting weaker. In terms of the General Assembly now, because you see quite a lot of resolution being pushed at the United Nations, being neglected. You see a lot of veto. The common thing happening now is the AUKUS scandal, AUKUS submarine scandal, pitting, allies against themselves. France is not happy with Britain. France is not happy with the US. Australia is coming in between them. And money is also coming between them. You see, if you just go and say, okay, I'm in the United Nations General Assembly, number 76, you UNGA 76, and you're going to talk, I think it's just a talk show. But having said that, it's important for us to drive this matter home. The theme essentially this year is to actually, they are looking for hope. They want to revitalize through hope. And then one of the first items of the team is actually to
build resilience. Build resilience through hope.
They want to build resilience through hope. And one of the key things is to recover from COVID-19. COVID-19 is a huge game changer in the world. Knocked down the world economy by as much as 7% GDP. Revert as much as 11 million people back to poverty in Nigeria, because again, people that are doing menial jobs, slum dwellers, urban poor, all of them reverted to poverty. They barely feed. And then the key game changer to reverse COVID-19, after we have tried to push non-pharmaceutical intervention, the key game changer is vaccine. Throughout the world, more than 5 billion vaccines deployed throughout the world. Even close to 6 billion, 5.9 something vaccines deployed throughout the world. Out of that, 195 million in Africa. So you see,
out of 195 million in Africa,
we're just getting to the point of 5 million or so. Nigeria of
I've got either both doses or at least one dose.
One dose is 5 million people in Nigeria. So now, as we have agreed, let's say if we don't agree, as we've seen, that vaccine is the game changer. Here we are now. Africa could not get vaccine. Even this at the end of this month, they're pushing for about 10% of Africa to be vaccinated. We can't get that the vaccine to do that. Even for this month-end target, we're still having a shortfall of more than 50 million doses of those vaccines, wherever. And then here we are. Some countries have double doses of their vaccines. Canada, for instance, Israel has done over and over, and they're taking booster doses now. Germany, nothing much is happening. They've had excess. And then we now see that the virus is going deeper, mutating, even hitting younger generation. And we're not talking about administering the vaccines to pediatric age group now. Okay?
Not just teenagers.
Not just teenagers. I mean, 5 years, 5 to 11 years.
Okay.
You know, that's the pediatric age group. So, you know, we're thinking of doing that now. At least in some countries, they're considering that, haven't shown that the vaccine is effective, and 1/3 dose of an adult can be given to those 5 years or so. And now that means is that there will be more demand for that vaccine. But unfortunately for us, in Africa, probably Morocco is trying to build a factory to manufacture the vaccine. South Africa is like a filling thing that is done with Johnson & Johnson, because it's completion of the production in South Africa. Apart from that, no other country in sub-Saharan Africa has access to manufacture the vaccine. Now, those people that can manufacture the vaccine abroad, Pfizer of this world, Moderna of this world, Johnson & Johnson of this world, they chose to manufacture for the developed countries who had paid in advance to take double doses of the requirement of their country. So now we now enter. What we now see is what we call politics of vaccine. Essentially, we're seeing vaccine diplomacy, you know, and vaccine nationalism. Nationalism in the sense that, first and foremost, I'm going to take as much vaccine as possible for my own people. Okay, I'll take as much vaccine for my own people, only my own people. That's nationalism. Diplomacy means that if you agree with me, if you are flowing with me, I have excess I can give to you to negotiate for some other things. So vaccine has entered the realm of politics. It has entered the realm of diplomacy. And even a country can choose to say, listen, I don't want your vaccine. It has entered into that realm. So, and we saw that playing out essentially from Russia and China, where they were pushing their vaccine to Middle Eastern country and Eastern Europe to manipulate opinions. Well, that is the realm we are now. Well, our president is going there.
Exactly.
To tell them that, listen, guys, you have vaccines. I don't have. We don't manufacture. Our economy was precarious before the advent of COVID. COVID has knocked us down. We've lost, you know, as much as 5% of our GDP to COVID. Trades cannot go on. The price of commodities are not improving. Okay, foreign remittance, which are actually the headwinds, economic headwinds of this COVID thing. Foreign remittance is reducing, and people are not getting money. We're trying to stimulate the economy. We don't have sufficient money for vaccine. COVAX cannot give us enough. Please, for the sake of humanity, let us look at vaccine equity. If I need 100 million doses, and you need 70 million doses. You that need 70 million doses, you are having what we call 200 million doses. Give us 50. Give us 50 out of it and keep the remaining 150 for your people. So that is the kind of discussion that's going to go on. But again, this discussion will go on.
Now, what will be the consideration, so to speak? Because when an adult gets up and speaks to another adult, you know I don't have, so you need to give me. You understand the simplistic, overly simplistic example I'm making. So usually lawyers talk about consideration. If you do something, then you get something back. Is it going to be just that, look, as some, I think I've heard of one American president, it's certainly not one, it must be Biden, saying until all of us are vaccinated, then none of us is actually safe.
Indeed.
And so taking it from that perspective, what can Nigeria, because Nigeria just doesn't want to be, a cap-in-hand figure. Say, look, give me, I need it, and I can't afford it. There must be some sort of, is there any such thing, or is it just a matter of, just give me? And how do we expect them to listen?
What is happening is that, you see, by taking that kind of campaign or aspiration to the level of United Nations General Assembly, you know that the 15 core agencies of United Nations, a lot of them are represented in health. WHO, UNICEF, United Nations Population for Fund Activity. All of them, they are represented within the UN. They're also still agencies of UN, including World Bank and IMF. They're all still, part of United Nations as it is. So now when you take that into that level and canvas for it, you are increasing the signaling, you are seeking for buying, you are seeking for people to stand up and say, listen, okay, no problem, Pfizer, can you sell this vaccine for us for $2 instead of $4, manufacture it elsewhere, so that we can then help pay you this amount of money, and then you can take to Nigeria.
All those those are the kind of
arrangements. Then secondly, the Serum Institute of India was actually the key supplier of our AstraZeneca vaccine. And when their cases rose up, they stopped production, they stopped shipping out of their country, they stopped export. Now, another obstacle is the fact that the licensing process by WHO is thorough to look at the vaccine and say that this is the vaccine that is going to help us, that we approve it. It's thorough. Those are limitations. Then the companies that are producing, they don't want to jump quickly to your country, to Nigeria, to do that. So what we're looking at, what the president's speech can really achieve is to say that, listen, guys, push more vaccine into the COVAX, for instance, push more vaccine directly to us. Let us have vaccine so that we have, equitable distribution of these vaccines. It is unconscionable that Africa, 1.3 billion people, is just having barely 185 million doses of the vaccines. Even for this end of the year, we're looking for 300 million doses to be able to do 10% vaccination of the population. So now that's the kind of thing we're going to get.
And that's what the president is taking over to the US, to the United Nations.
Indeed.
To speak in this committee of nations. Let me bring into this conversation Dr. Thomas Wilson Ikubese. He's on Zoom. He's a family physician, medical director of, did I say it right, Skype Hospital. Good morning, doctor. Dr. Ikubese, good morning. Going by what happened yesterday, I'm just going to guess that we will hear you ultimately, because this is how it started out yesterday. Dr. Thomas Wilson Ikubese, a family physician, he can't hear us. I don't think, yet. Let me try again. Dr. Ikubese, good morning. Yeah, it's not working yet, but no fear, it will work. It happened yesterday and it worked subsequently. So I don't know if anybody else can hear Dr. Ikubese, who is joining us remotely for now. In the meantime, while we're trying to sort all of that out, let me bring up Dr. Mebawoudu. The question that I think a coalition of some of those world United Nations bodies, yes, not the medical people, well, maybe even then, because I want to bring them into this particular point I want to make. There was a time when there was talk that, look, you people are licensed, and we know in big pharma how very, very important this is. So people can't just get up. Now, maybe you need to, well, we can't tell them what they need. Maybe we need to get to a place where you can release the license so that we can sort of help ourselves in Africa, or whoever has the capability to manufacture will know, and let them sort of find a way to help themselves. There was a time when World Bank, among others, were looking at that particular issue. What do you think of that particular notion?
What you can do really for a country, because let's face it, the COVID is going to be with us for some time, no doubt, until we get around it. Probably if you can limit the critical volume, number of people infected, then and prevent mutation, it's going to be with us. So while we're working at that, where we're hoping to get to that point is to see a way that we can have sufficient supply of the vaccine, okay? And then what the country should be doing is to looking at a manufacturing agreement, licensing agreement to manufacture. The agreement is actually gotten from those people that have the technology. Let's face it, those technology are not. It's been a lengthy research and a lot of money being put into it. While we're really busy trying to figure out how cow is going to move in a place like Nigeria, guys are busy researching and thinking ahead. So, you know, if we don't think ahead and you're like that, what you now need is that, okay, you have done user research for the past 10 years or more than try to figure out the best way to deliver vaccine should anything happen. Now you are perfected to this stage. We want a licensing agreement. The licensing agreement will tell you the terms and conditions to be used, you know, and then you have to, after the licensing agreement, you have to get the technical expertise to actually move to your location, maybe your country, and build a factory. I think Sierra Leone is also trying to do one, and build a factory, okay, that can manufacture those vaccines, because they are very, very technical, highly technical work. It's not, you are not manufacturing pure water. So, you know, then if you get the licensing agreement, you get the factory set, then the agreement will also cover the ability to support you in the manufacturing process for a certain number of years. Okay? What then happens is that then you can scale up, or you can readapt the factory to fit into any of those vaccines you may want to manufacture in future. Now, this are the kind of agreement that you need to get at the level of government. What I'm expecting at the side talks, at those side committee meetings, because the United Nations is actually the debate, you know,
yes.
And then the side committees. What I'm expecting at the level of the sidelines is for Nigerian people to come together. Well, I've not seen the health minister in the delegation. I expected him to be in the delegation. You know, some of our top scientists, or maybe one or two VCs that are really, you come. Guys, where are the people with Pfizer? We want to meet with you in the United Nations. Okay. You come there, you discuss.
But all of this, it seems to indicate that it's not going to happen anytime in the immediate.
No, it's not going to happen. You see, the best our president can do is just to talk. Yeah, yes, we're having challenges. Terrorists is hitting us. COVID is hitting us. Give us vaccine. It's just going to be plea.
Well, as the Nigeria's permanent representative at the United Nations had been saying, he said the president is going to really be quite, you know, I don't know, no, heavy is not the word, but it's one of his main, in fact, the main reason he's going in there. Yes, he will talk about other things, but the president has ideas in terms of how do we solve this health pandemic, and he will be unfolding some of those ideas to, you know, his peers over there at the U.S. Let me try Dr. Wilson Ikubese again. Dr. Wilson Ikubese, any luck? Okay, we're still working on Dr. Ikubese.
Now, you see, the point is this. Let's not. Let's be diplomatic here, because United Nations is just about diplomacy. Somebody will say, okay, listen, I want you to give me vaccine. They say, okay, they pull out your health reports, because it's out there. The number of doctors in Nigeria, the number of nurses, their distribution, their strength, everything.
And our COVID numbers. Where did they get our COVID numbers from?
They'll get
considering that you doctors are among people who criticize us that you are not sure that we are really testing as much as we could. That should that have been the case?
There's scientific modeling and projections. Sir, don't worry. Even if you are not testing it for enough, there's scientific modeling and projection that by this, these are the likely things, but this is what they have tested.
Okay.
And then they look at it and use that to project that if they had tested this number, what are we going to get? Okay, there will be positivity rates which they're looking at and can be used to project across population. That is a simple thing.
Okay, it's a simple thing.
But having said that, you do your health. I look at it that you see, their doctors are on strike for how many months? The notice there's a lot of labor challenge issues in their health system. The health system is so weak and fragile, or even non-existent in certain cases. Then how do I do? Do I now go and put a factory? Sorry, sir. Do I now go and put a factory where I'm having this kind of thing? How do I support and manage these things? These are issues. So now, even if you are pushing and talking about it, they look at it, okay, well, we can do this, but there's no capability for this country to absorb all we can do. The best they can absorb is for us to keep donating, and we hope that they give those vaccines sufficiently. And of course, the right thinking would have been that vaccine will be so adaptable to their environment. Recently, you saw that Britain was even telling you that even if you have taken your 2 doses of vaccines from Nigeria, you still have to undergo quarantine for 10 days. which normally those are the kind of things we should protest. I said that this should not be, and write a letter. This vaccine came from you. If we give it, why should it be that your own can protect you, our own cannot protect us?
Reverend Dominic, good morning, sir, and thank you for holding on. Go right ahead now, please.
Good morning, Yori.
Good morning.
Good morning, Dr. Tuyi.
Yes.
Good morning, Reverend.
Doctor, the question I want to ask, is a conditional question. How is it that our big nation, Nigeria, is always playing this beggarly attitude? How is it that South Africa could have some arrangement to manufacture, and a nation of 200 million people, oil producing nation in quotes, could not even do testing? Doctor, I have experience last week. I was unwell, and I myself and my doctor were laughing at us that the medicine I used before, that's the medicine I used before, that's my health defiant. That in Lagos, we may get 5 million people who are.
It does look. Oh dear. Reverend Dominic, it does seem as if the bandwidth is sounding strangulated, if you get what I mean. No, it's not working. Thank you very. Reverend Dominic, could you do us the favor and see if you could call in again? Maybe that would have sort of jogged the thing a bit and push whatever is blocking this this line I have in my mind. Push the blockage out so that we can hear you clearly. Normally we do hear you clearly, but today looks to be one of those it's setting up to be one of those kind of days. We were hoping to be able to talk to Dr. Thomas Wilson Ikubese. That is still working. We're still working on that. In fact, I hear that Dr. Ikubese is standing by now. Good morning, Dr. Ikubese.
Good morning, Chief Yori.
Oh, thank you very much for joining us, Doctor. It's just Yori, as you know. You're a family physician, and is it your hospital is a Skyke or Sky?
Skaye. Skaye, actually, pronounced as Skaye.
Oh, Skaye.
Skaye Hospital.
Skaye.
Right.
Almost, just Skaye. Think of Kanye and then make it Skaye. Okay, now, I hope you've been able to listen to part of our conversation, at least, with the line being what it is. I wanted to ask you, now the president's going to be in the U.S. And he's going at the United Nations, and he's going to be putting forth, his vision for what we need to do, of course, health being first. Give me, if you will, your impression of what we can get out of that, because there are those who say that, look, these talk shops are just that, talk shops. Do you expect that there will be an appreciable change to our vaccine regime and our whole methodology now that the president is with his peers in the United Nations and will be sharing some ideas?
Well, when it comes to the issue of vaccination of COVID-19, I think the government has done significantly well. If you're going to compare with how they have done in other parts of health sector. But the major problem that we seem to be having is these several conspiracy theories that people are propounding about the fakeness of COVID-19 being touted by different people for various reasons. And that's why I think the government should actually spend more time in public enlightenment, in dissuading all of these rumors and fake theories and propagation of conspiracy theories that people have been spreading. The other day you see people come with a video of somebody putting a bulb in their hand and it's lighting light. All manners of fake rumors. Just yesterday, there was another fake rumor on Twitter that the United Kingdom has banned other countries that did not have vaccination from the UK from coming into the UK. And we checked and realized it is false. So while we commend what Mr. President is doing with regard to going to the United Nations global vaccination for for COVID-19. It's highly commendable. At least in this aspect, the government is not doing badly. But I think more time should be spent on the issue of public enlightenment. Those days we used to have a National Orientation Agency, MAMSA and the rest of them, and they make so much noise, you know. But I think we need to have that done now so that the minds of the people can be neutralized about all of these rules.
Let me stay with you, Doctor. Because you touched on it yourself, this conspiracy theory, you know, there are those who are vaccine skeptic. It doesn't matter what you say, they have determined that it is not good for them. And we've also had the conversation that government doesn't seem to be at liberty to enforce by law, you know, you're getting the vaccine. Now, these stories are not diminishing that, you know, there's something wrong with the vaccine. And when you combine that with the situation in Nigeria, where going by all the statistical projections, when COVID first of all hit us, I mean, you would have thought that by now, bearing in mind our conditions in this country, that maybe half of our population would be at risk. But it has been surprisingly not that way at all. Have you also been surprised, Doctor, that on the advent of COVID-19, it hasn't been as bad as the world had thought, especially with this, is it a third wave now? Is it second or third wave, where they say this is much more virulent? But still, we still are having cases, but it's nowhere near as bad as people have had in the West, for instance. What do you think is going on, Doctor?
Yeah, you know, people used to say maybe God is a Nigerian after all. You know, I was just speaking with a European friend just 2 days ago, and she told me the kind of fatality that is being suffered in her country. People who take the vaccine and they have fatalities, you know, in their countries. And I said, well, this is the same vaccine we are taking in my country, and we don't seem to be having this kind of fatalities. You know, I said, well, it's the same thing. We don't know what is happening. So I think there are things we still need to discover about the virus. You know, this is a fairly new pathology. Not so new, but at least the infectious rate is relatively new. And a lot of things still needs to be studied. And indeed, the scientific world is still studying so much about the vaccine, about the disease itself, the mutation, the variant, the role that the genetics have to play, the role that the environments have to play. You know, so I think it looks like we have some kind of advantage compared to what we are.
Okay.
To make sure, absolute need for us to make sure that we still obey the COVID-19 protocols, even though we've seen that it's not virulent as we observe in some other part of the world. But that should not make us to be so redundant as to overlook some of the things that we need to do to protect ourselves and to protect the people around us. Now, some states are coming up with the proposal that if you do not have the COVID-19 certificate, you cannot access public places. Well, I think we should do more of enlightenment. I believe sincerely that if we can dissuade the mind of people and take off the rumors and the conspiracy theories, people will walk voluntarily and offer themselves to take the COVID-19 vaccine. I tell you, if not for some of these measures, even health workers, many of them are afraid because of all these rumors that we are hearing. You know, so I think a lot of time, a lot of money, emphasis and energy should be spent in dissuading these conspiracy theories that the vaccine is safe and there is need for us to get vaccinated.
Dr. Mebawoudu, I've asked you this question before, but I'm going to ask it again at this time. Why do you think we are getting off as lightly as we are? I am the person using the phrase as lightly as we are because, you know, doctors might have a different notion of the whole thing. But people were scared when the thing first hit. We have done all that we could. The figures, we still are shocked. We still are surprised when we hear of certain deaths. Some of them admitted to be due to COVID-19. Others, you know, it's just speculative. But by and large, we've sort of got a fair shake from fortune, so to speak. Fate and fortune has dealt us a good hand, so to speak.
Indeed. Younger population obviously actually play a role. You know that the fatality of COVID infection in children, or let's say in teenager, young adults, is less than in older generation. We're a country of a young population.
Okay.
Very young population.
So that played into it.
Yeah, it's like an inverted pyramid in a way. A lot of the younger people are up there. So many population of that. So that could be a factor. Secondly, we seem to have a lot of experience with different vaccines. You know, we deploy vaccine for very a lot of things. We have our own bouts of recurrent epidemics in this part of the world, you know, that we may not understand fully until probably further research then demonstrate to us why those could be a confounding factors in the severity of COVID, as the case may be. So, there are various possibilities. But of course, as usual, when those possibilities cannot be explained, we put a God factor to it. But when we then explain it,
yes,
we agree that this is the reason.
Okay, so, Dr. Ikubese, are you there?
Yes, I'm here.
Yeah. Now, we're talking about COVID. It's like we always talk about it in terms of wholesome public health. And, you know, our permanent representative at the United Nations has been saying there's nothing more important. Everybody agrees with him. But coming back home, let me ask you first, and I'll also ask our public health expert, Dr. Mebawoudu, the same question. There seems to be a lot of talk in Nigeria about people having contracted COVID and having survived COVID without resort to, you know, the normal COVID chain. You just hear somebody say discreetly that, you know, I actually had COVID, but I sorted it out. They talk after, they speak after they've come back from it. Give me your experience in terms of hearing these kind of things, because I know you're a doctor and you're going to have very short shrift for any non-medical kind of intervention. But have you heard this thing that I have heard, you know, plentifully, that I had COVID and I came out of it?
Yes, we hear such stories every now and then. I think one restraint, one limitation that we have is the issue of testing. As it were, most people just assume that if they are coughing, if they have respiratory condition that is making it difficult for them to be comfortable with their breathing, then they probably have COVID. You know, so some of those who say that they had COVID and they came out of it without any test, without going through any laboratory investigation, that is not scientific. But having said that, we also do know that we have more people with COVID out there than we have documented. Because of our system, we have very poor data analysis, very poor documentation in this part of the world. So it will not be out of place to say that we probably have
okay. I think I get what happens. When every time your screen sleeps, it results in an audio cut. Something else I wanted to pick up with you about what you said. Maybe I'll get a chance later on, because when you said there are probably many more people out there with COVID than our numbers are indicating, I want to come back and query you on that, because you're a man of science. Where would you get that kind of inference from? But in the meantime, Ada has called in from Jos. Good morning, ma'am.
Good morning, Mr. Yori. Good morning to your guest.
Yes.
Ada from Jos.
Okay.
As much as I believe in equitable distribution of vaccines, I feel Nigeria should start looking inwards to produce its own vaccines, and the other African countries will look up to us. We have the capacity in terms of expertise and otherwise. If we put our priorities right, we are not a poor country. Our problem is high cost of governance, corruption, and misplaced priority. And in 2023, as far as I'm concerned, we should look for a visionary leader who can employ strategic thinking to get us where we ought to be. We cannot continue to depend on the Western world. A time will come when they will disappoint us. Now we are calling God. You know what? The Delta variant is now attacking the younger population. we had an advantage because of our population, but now it's attacking the younger population, which is a big problem. Then when we are talking about making it compulsory, some states have like to make it compulsory, talking about having a certificate before you're allowed to enter some areas. You know, Nigerians, you can't beat them. I saw a streaming headline. I even watched on television. It was a Delta state or so, where people now went and started getting some people. They even arrested them. They started selling fake certificates. Can you imagine Nigeria for you? So that's an issue. So we have a lot of problems. So and then there's vaccine hesitancy, just like one of your guys has said there. There's so much vaccine hesitancy. About 30 people I've talked to, all of them told me that nothing will make them take that vaccine. No matter nothing, nobody can force them to take it.
Yeah.
You know.
Yeah.
So it's an issue.
All right,
so we have to look at the way to deal with it. For me, it's advocacy and not forcing anybody. Some people's religion don't even allow them to take it. This one I know. Some even among Christians, there are some denominations that don't take vaccine. They don't take blood. So I don't know. So let's not get to a point where we have crisis in the country. Let's not give up on this country. God bless Nigeria.
Well, thank you very much for calling in, Ada. Dr. Ikubese, I said I wanted to pick up an issue with you. When you said you have the impression that there are many more people with COVID than NCDC figures would seem to indicate, where did you get that notion from?
Okay, I got that from the fact that we don't seem to have too much of test centers, as it were. You know, the number two is the fact that just 2 days ago, a friend called me from one of the molecular laboratories. He's a medical lab scientist that works in one of the molecular laboratories. And he told me, he said, "Doc, please ensure that in your hospital, you and your staff are continually protected and insist that your patients put on masks." I said, "Of course, I do that compulsorily in my center." And then I said, "Why are you saying what I already know?" And he said, "Because they see a lot of cases, far more than is being reported, but that they are deliberately downplaying it to avoid panic." That's why it's worth.
Okay.
And I'm a clinician. Yes, I'm a clinician. I see cases. My colleagues, we see cases. We discuss it. Some of these cases we refer, and some of them are not properly as documented as the number of referrals that we have. And that's why I say that I strongly believe that we actually have more cases out there than is being reported.
Okay. Mr. Yakub in Dokwemo, good morning, sir. Go right ahead, please.
Yeah, good morning, Chief Yori, and then good morning to your two guests.
Yes.
Quickly, Chief Yori, I think I totally agree with Dr. Ikubese and then Dr. Mebawoudu. Nigerian government should do the needful in terms of information, to take that information to the grassroots. Why am I saying that? They should be able to have an agent like Nigerian Orientation Agency should be able to go to marketplaces. Chief Yori, if you go to market today, I can tell you the 85% of market women are not taking this injection, this vaccine. Why? Why? Because if they don't go out for a day, they cannot make any. And then they believe that, in fact, the conspiracy is also going on in the market. In the marketplaces, if you go there, wear your nose mask, they will be looking at you as if you come from another clan. Let me just give you a tip here. You know, last month, yes. Last month, I went to a center here, especially in Orili Agege here. Getting to that place, they said I should come back to the following day. They never start. And then finally, I got the fourth jab, Tivjori. And then what I noticed is that people, Tivjori, the first message is too many. People were saying this thing is magnet, this is this. Tivjori, believe in me, I took this thing. What I just feel is that I feel dizzy, and then I slept for 1 hour, and then I'm okay. Do you not know that when I go back home, Chief Jody, it is funny. I asked my wife to go and take this same vaccine. She told me that she will never take it. Up to today, we are still fighting on it because I believe that if I can take it as your husband, you need to take it,
yes,
whether you like it or not. He said that people are taking it. They say that it's going to reduce their life. I say this is not true. This is not true. Why? Because the people that they were living with the environment in the house, they were telling them all sorts of nonsense. You get, and then social media as well. People will say 666. What is the 666 all about? Basically what I'm trying to say in essence this morning is that Nigeria, I'm using this opportunity to pass that message. Nigerian people, you should take it. Nothing will happen to you.
Okay.
Tomorrow is the second jab I'm going to take it. Nothing will happen. Good morning and God bless you, sir.
Thank you very much. You've answered the question I would have liked to ask. How far along are you? And tomorrow you'll be completing your dose. Now I want to bring, because I think it was Dr. Ikubese who said it, but I'm going to ask you the question. You guys are doctors, so you know what each other is saying. He spoke about booster jabs. That's what some are in the midst of over there. And this was in relation to how comfortable some are in the production. They are thinking of booster jabs now. We are not talking about or thinking about booster jabs, or are we?
First and foremost, we've not deployed sufficient vaccines doses. We've not administered enough. Nigeria was targeting 60% coverage for the population. We're still at the level of barely 2% or thereabouts. So we can't be talking about booster jab because we don't have the requisite vaccines to do that, to make that happen. That is there. Secondly, a lot of people, when those vaccine hesitants and doubters and those who actually refuse vaccine, they will tell you that why are they giving booster jabs? And I'll tell them that there's so many vaccines in use that needs booster jabs. If you take cholera vaccine, you probably have to repeat it after 6 months. If you take typhoid vaccine, you have to wait for another 3 years to repeat it. There are a lot, even when you are entering school, you have to actually have a booster dose of maybe meningitis or measles, as the case may be. The booster doses of vaccines is not new to population. Okay. But I also feel concerned about the level of faith-based attack on the vaccines. Okay. And then, like I said over and over here, the doubters will always be with us. You know, but again, let's also drive our messages to ensure that we touch those people that want to hear. Even in the so-called super America that everybody, America, they are flat earthers, people that believe that the earth is flat and think that,
and there are quite a number of vaccine skeptics in America as
the
well.
Luddites, the Luddites and co, they don't even want to embrace technology. They're still holding on to something. They don't want telephone. They don't want electricity. They don't want to use any technology implement. They are there.
But
they're there. What is more important is that
are basing their doubt on the speed with which this vaccine was developed.
Listen,
they say,
the first car in the world, what was the speed? The next car, what was it? Improvement will come because people are doing research.
Okay, so I can't keep Mazi Okorafor waiting any longer. Good morning, Mazi Okorafor.
Good morning, sir. Good morning, our doctor.
Sure.
I want to find out from our doctor. Doctor, this vaccine we are using now, what's the expiring date of the vaccine we are bringing in? Thank God that our president is in US. If you look at the population of Nigeria presently, what we have now and what we're expecting will not even cover up to 5%. Does it mean that all those stories they told us about that 2020 and early 2021 about our own our own vaccine, which are being inside the cooler with the NAFDAC, what is delaying it? Because if we are to produce our own now, it will help us cover at least take up to 30 or 40%. Because no matter whatever we bring in from outside, within the one the president will bring back.
Okay, but Mazi, just Mazi, a little clarification from you, please. What do you mean by expiry date? Because these vaccines
there is
are
no
fresh.
drug that doesn't have expiry date, and there's no vaccine that if you keep it not used that doesn't expire.
Oh, okay.
There's no vaccine that you keep that will stay forever. There's nothing like even ordinary food you eat. After eating it for some hours, you pass through the central, pass out through the nervous system, and you pass it through the physics. So that's why I'm asking, when is this vaccine going to expire? Thank you very much.
Okay, thank you very much, Mazi Okorafor. Dr. Ikubese, would you like to take a stab at that question? The question of expiry dates vis-a-vis vaccine.
Okay, in terms of the expiry date, if you look at the bottle of each of the vaccines, you find them clearly there. The fear of expiry date does not even occur with COVID-19. The reason is because they are being produced they are being used perhaps faster than they are being produced. Unlike other medications that you produce them and keep them in the stock. Yes, there's no time to waste. As we are producing, we are using them. So Mazi Okorafor, don't be worried about expiry date. The expiry date is still far compared to when the medications have been used for vaccination.
In Nigeria now, Dr. Mebawoudu, the reference has been made to some government efforts, some governments, state governments' efforts to compel their citizens. Lawyers have immediately you get people getting up to explain how no, there's a constitution. We have a constitution here, and you can't go against the constitution. It is everybody's right to die any way he wants to. Not that that's the way they say it, but it's everybody's right to not accept, to not take the vaccine. So I understand some companies now are sort of going round about the issue by saying that, fine, if you can't show us your vaccination certificate, you might not be able to gain access to the premises. And if you don't gain access to the premises, you're going to be absent from your desk. And if you're absent from your desk, you know that you can't expect to be paid. And so, people are just trying all sorts of ways to see, will people accept this vaccine? But those, unfortunately, the naysayers, the conspiracy theorists, they're making this whole point that you were explaining, that how can you give me a vaccine in less than 2 years when we know smallpox vaccine, look how long they worked on that. This other vaccine, look how long they worked on that. You now rush this thing because of Big Pharma. So they think it's a conspiracy. In fact, there are those who are even saying, God forbid, there is no COVID-19, and they are getting listeners.
You always get listeners, whatever it is. For me, with the decision of those state governments and part of some companies, we must establish some parameters. There are metrics, clear metrics that must be satisfied before you can push that. One, do you have sufficient dose of vaccines? Are people properly educated about it? Now, if you have sufficient dose of vaccines and it's available, okay, then you can look at it that take vaccines. Because there's a challenge of protecting public health. There's a challenge of protecting public health. No matter how much we say that you have right away, but again, you must also consider the fact that other people have right to live also. You don't then transmit disease to other people in a public emergencies like this. So
there's that social responsibility aspect
yes,
of it.
You have to. So, but unfortunately, we have not gotten there where people should be saying that. You know why I said that? Because we don't have sufficient vaccine to even give to people. In the first instance, we don't have sufficient vaccine. So if you don't have sufficient vaccine, why are you now trying to push for restriction of conditionality of vaccine cards as a passport to enter a place?
Let me quickly take Mr. Maduka in the UK. Good morning, sir.
Good morning, sincerely.
Good morning. Thank you very much for calling. Yeah. Go ahead, please.
Just two things. Quick one.
Yeah.
Quick ones. One, I heard you when you asked the question the incident of COVID in Nigeria so far. What might be the reason? I had an argument in my hospital here in the UK with a couple of friends, one of them from Ghana. They all believe that because we're not affected enough, that's why it's a product. But I want to tell you, what is the matter? The point that I is alive. I cannot be alive. So, because of the answer, they don't know. Thinking of that implications of even the vaccine works. Because the vaccine is there, so
Mr. Maduka, the lines are not actually favoring us, but I did get that the sort of question I had posed, that you have also had that conversation over in the UK where you are at. Unfortunately, the lines weren't good enough for me to hear much more. But as Dr. Mebawoudu has said in a different context, this vaccine is not going anywhere soon. So there will be plenty of time for us to talk about it, but hopefully we can, you know, along as we're talking, we're also doing everything that we can to get rid of the virus, get it out of our system, get it out of our country, and get it out of our population. But we're going to have to leave it there for now. And in this connection, I want to thank Dr. Thomas Wilson Ikubese, family physician. Thank you very much for, you know, making time for us this morning. As I indeed register our thanks, we have with Dr. Tuyi Mebawoudu, public health expert. Thank you very much, Dr. Mebawoudu. We grab hold of him when we need a public health expert, and we thank you very much that more times than not.
Always a pleasure.
Thank you very much.
It's a CSR.
Indeed, a corporate social responsibility thing. So that's our program. We're going to have to leave it there, but we'll continue the conversation. It might be a different subject tomorrow, God, you know, being our strength. In the meantime, do consider government's offer of the COVID vaccine. In any case, socially distance appropriately. Mask up. Wash your hands. Is there one other one? But those three, I remember those three. So that's it. See what you can to bring down the incidence of COVID. We'll see you tomorrow, God willing. I'm Yori Folarin. Bye-bye for now.